Hi, and welcome to 10 Kids, 2 Docs, Parenting Insights from Pediatrician Moms. I'm Dr. Sylvia Bank.
And I'm Dr. Vivian Carlin. We have a special treat for you today. We have a guest joining us on the show, and that is Dr. Bobby Geiman. He is a practicing orthodontist and has a particular interest in pediatric dentistry, as he's on faculty at Yale University and teaches residents in the Department of Pediatric Dentistry. And when I was first introduced to Dr. Geiman, one of the things that most compelled me to have him join us was that he's written a book entitled The Tooth Bible, A Parent's Guide to Their Child's Smile. So I felt like, similar to Sylvia and I, Dr. Geiman has an interest in educating parents so that they can make the best decisions for the health of their children. And Bobby, I believe I'm correct in saying that you have 2 children. Is that correct?
I do. I have 8-year-old twins, boy-girl twins. So I get a little bit of everything.
Okay, awesome. So today we are actually 12 kids, 3 docs.
There we go.
For our discussion on pediatric dentistry. So let's jump in.
Welcome to the 10 Kids, 2 Docs podcast. Seasoned pediatricians and longtime friends, Sylvia Bank and Vivian Carlin have counseled thousands of parents and are raising 4 and 6 kids, respectively. Join these doctor moms as they incorporate fun and their combined wisdom and experience to share parenting insights for anyone looking for practical and trustworthy guidance. Please note that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment from your doctor.
So tell us a little bit about yourself, Dr. Geiman.
Sure. Well, thank you for having me. My name is Bobby Geiman. I am an orthodontist, father, author, practice owner, faculty.
And now podcaster, right?
Oh, now podcaster, yes. So I grew up and had all my education in the Northeast between New Jersey, New York, Boston, and Maryland. Now I reside on the shoreline of Connecticut, and Yale is right around the corner from us. So it's very convenient to have a pediatric dentistry program there. So I teach the residents a bit over there and focus on my patients in my practice. Decided to write a book at some point, but it all came about as probably just like you guys, you get similar questions over and over again, and you realize that parents, they may not know certain things that they should know. I didn't know a lot about being a parent before I was a parent. I learned on the fly. So I decided, let me put these questions together all in one place as a reference guide so that parents can empower themselves and they can be their own advocate. So that's part of what the book is about.
Yeah. Well, I think that's a great lead into when I think about what we get questions about all the time is related to cavities, right? So I'd sort of like to start there.
Okay, so let's just start with the word cavity. So cavity is a small area of cavitation where plaque over time created a little bit of a divot or a little bit of a hole. It's usually microscopic, you can't see it. And that bacteria, using byproducts of sugar, creates acid. That acid makes that little indentation into enamel, and enamel is the outer surface of a tooth. And enamel is super strong, but if you put acid on it for long enough, eventually it weakens and you get a small cavity. And the cavity gets bigger, it goes into the next part of the tooth, which is called dentin. And dentin is not as strong as enamel. Once it gets to the dentin, then it spreads a little faster. We take x-rays to see other cavities because usually we can't necessarily see them, especially based on where they are in the tooth.
How often do you think those x-rays need to be taken?
Great question. So the first x-rays for most kids are usually taken somewhere around age 3, 4, 5. They have to be able to handle taking the x-rays. The mouth has to be big enough. They have to be mature enough to be able to handle them as well. And they have to be able to sit in the chair, right? At that age, your baby molars are all in. And so it makes sense to kind of wait until that time point to take those first x-rays. Now, if the kid has no cavities and they have good oral hygiene, there's no reason to radiate them every year, right? But what if on that first x-ray, we found 3 cavities? And then, well, once you have one cavity, it's a little easier to get the next cavity and the next cavity.
Right.
So the kids who have regular cavities, you got to take x-rays more frequently. And in reverse, the kids who have perfect hygiene and no cavities, you can spread it out, spread it out, spread it out.
Got it.
Okay, so this is funny because I remember when I was growing up, every time I would go to the dentist, my mom would make a comment in the car about they always want to do x-rays and I think that radiation must be bad. So she would always argue with them on the x-ray.
Let's just talk about that, about x-rays in
Yeah.
general. Yeah,
Yeah, yeah, yeah.
x-rays are not good for you. I think everyone can universally agree that an x-ray is not necessarily good for you. But what you find in that x-ray and fixing that can be way more beneficial than the risk of the radiation you get.
Right.
So go into your Google and type in American Nuclear Society. It's kind of a crazy name, but American Nuclear Society, and then dose calculator. So what that shows is what is the radiation equivalence of a dental x-ray. Now, another point to bring up, modern x-rays, digital x-rays, are a fraction of the radiation that the old x-rays when we were kids used to be. So the dosages of the x-rays have gone down significantly.
Okay, cool. So I just looked on this site, and the dental bite wing imaging is the equivalent of the amount of radiation you get for 1 hour in the air on a plane. Okay, so my mom was not necessarily wrong. Like, it was more radiation then, but at the same time, she was probably a little overly concerned when she would say this. Can you explain, like, we think of cavities as really a significant problem with the primary teeth, with the baby teeth, right? Can you explain that process and
Sure.
why this is so much more common in childhood?
So you can get a cavity in a baby tooth and an adult tooth. Let's just kind of talk about what the purposes of baby teeth are first. We use them to chew for nutrition, to bite into things and to chew things. The second important thing about baby teeth is that they're holding space for adult teeth. Kids get cavities at any age, really. But those baby teeth, for the most part, are falling out over time between the ages of 6 and 12. Right? So that's the transition period. So 0 to 3, we'll call it, is when we're getting our baby teeth. 3 to 6 is when we have all our baby teeth. We call that the primary dentition. And between 6 and 12 is the transition period. And then 12 on is all of our adult teeth. Not necessarily that the baby teeth are weaker or necessarily more prone. I think that it's just a little bit harder to brush baby teeth. It's harder for a kid to brush their teeth. And flossing, like what 4-year-old is really doing a good job flossing. And the recommendation from the American Pediatric Dentistry Academy is that as soon as there's a tooth in the mouth, that tooth should have fluoride touching it when they brush their teeth, right?
Really?
Okay,
So-
that was going to be a question we had
Oh,
for
yeah.
you.
Yeah.
Does the age matter? Or is it?
It's just the teeth matter, right? So
Yeah.
whether you're born with a tooth, which is more rare, whether the tooth comes in at 2 months or on average, which is around month 7, once you see a little bit of enamel in there, let's get some
So
tooth
there's
lift out
not
of it.
that concern that if you're brushing that one tooth in your baby, that they're ingesting the fluorinated toothpaste as well, instead of rinsing and spitting like adults do when they brush their teeth.
So no matter how well you or me or a kid brushes the teeth, you're always going to ingest a little bit,
Right.
without question. The recommendation for the amount of toothpaste for a kid, like a
Mhm.
little one, is going to be what's called a schmear. So imagine like you're smearing cream cheese or butter on toast,
Yeah.
right? So that little level, you can barely see it,
Mhm.
right? So as little as possible is really what it means, because you're trying to just get a little bit on there. As you get older, then you're going more to like a pea-sized. But I
Mhm.
would say we all over toothpaste our toothbrush, if you
Yeah.
will. No one really needs as much toothpaste as we're putting on our toothbrush. So yes, you're going to ingest a little bit because you're not going to perfectly
So
spit it
you
out,
would say
especially a kid.
smear size before you can rinse and spit, pea-sized when you can rinse and spit. Is that what
No,
you're saying?
it's really smear size, like for with the baby teeth, right?
Okay.
Keep it light. Yep. And then as you get older, you're increasing the size.
Like, so there's no factor of can you rinse and spit?
The reason for the schmear is because you're almost saying, well, my kid's not gonna be able to spit this out. They're
Right.
pretty much definitely gonna swallow most of this. That's
Mhm.
why it's so little,
Okay.
right? Because the toothbrush itself is the mechanical debridement or removal of any plaque that's there,
Mhm.
and then it's the toothpaste that's more of the chemical effect of it. Okay.
Because I think when a parent goes to the dentist and they're told that their child has 1, 2, or even 6 cavities at once, that's like a failure mode for parents. They're like, "Oh, I
What did I
totally
do
botched
wrong?
this up. Like, I did something wrong." I wanna hear from you. Like, what do you tell parents? What recommendations do you give them?
Yeah, I don't usually say it's not your fault. I'm pretty straight up with my parents. All right, let's say the reason for cavities are threefold. Okay, what you put in your mouth, so diet, oral hygiene, how
Mhm.
well you take care of your teeth, and then genetics. So can't really do much about genetics,
Right.
but the only thing to do about genetics is know your genetics. So as a parent, if you have a mouthful of fillings or crown, and you know that as a kid, you remember going to the dentist a lot, having a lot of fillings, maybe your genetics or your saliva is such that you're going to be more prone to cavities and your kid is going to be more prone to cavities that I had. And that goes to both diet and how well you take care of them. So let's start with diet. We got to be smart about it. My kids have snacks, actually a good amount of snacks, but they're not having it after they brush their teeth at night. They're certainly not having any juice boxes at night before they go to sleep. Some sugars are worse than others. So the sugars from a Jolly Rancher or from a fruit juice are very different than the sugars that are broken down from a vegetable or a fruit. So diet's super important. And diet's something that we control, right? So we want to give them things that are relatively good for them. I get this question all the time. What's more important, the night brush or the morning brush?
Oh, yeah, that
And
comes
my
up all the
usual
time.
response is depends on what your morning breath is like. But for a kid, right, they're ate all day, right? So that's when the food is going to be most stuck on there. To me, for a kid, the most important brush is nighttime. But I would do night and morning. It's also, you're still building the habit. I think it's very important to lead by example as a parent. And whether you've had wonderful dental experiences, you have no cavities and you have this perfect smile and everything is joyous, or you've had just a really hard go with your teeth, you cannot project your problems onto your kid. Because if you're like, oh, you're going to get cavities, it's going to hurt a lot, you better brush your teeth. Well, guess what? Then the kid's going to be scared of getting cavities. Then it's going to snowball into all the negative dental things, and that's going to affect them at the dental office. They're going to be more scared about going to the dentist. That is not what you want to say to your kid.
Yeah, that's a good point. My interest in this peaks from my own experience as a parent because, I have 6 children, so I've got a fairly nice sample size in my house, all of which have the same exposure to, the same kind of snacks, the same kind of hygiene being taught to them, the same level of fluoride, right? Like
water.
there's fluoride in their water, what we're doing at the dentist. And I also, 2 of mine are adopted, so I have different genetics. And I've had that really embarrassing moment at the dentist where one of mine is being diagnosed with cavities and the other one who has never had cavities pipes in and is like, well, I had terrible teeth brushing and I don't have any cavities. And I'm like, oh my gosh, you just threw me under the bus. Like I made sure you brushed your teeth morning and night. Like I like this bold statement of like, well, I was a terrible teeth brusher, and look at me, I don't have any cavities. So I have become sympathetic to that parent who's
Of course.
feels like they're doing the right things and their children are still getting cavities. And through that, I've kind of learned that, well, there's a component of were you born prematurely that can affect the enamel development during pregnancy, genetics or whatever. But maybe that's just me justifying what happened. But I'm curious your thoughts on that. Like, how would you speak to me as a mom when I've got the 2 that are clearly prone? Those are different genetically, and everything else as much as I could was in my control. Everything else was the same. Give me some thoughts on that.
I think genetics, I have a boy and girl twin, right? So they're siblings, right? And their genetics, even though they came from the same parents, are wildly different. Like, are they related? Right?
Okay.
And the same thing can be true for your children, right? Like it's not fair. I see it all the time where you have like one kid with terrible hygiene. It's like, this is gross. And then they don't have cavities. You're like, how do you not have a cavity? I don't believe this. Let me take another x-ray. I'm just kidding. But and then in reverse, you're like, okay, this kid has okay hygiene, not good, but not bad. And then they got a mouthful of cavities, right?
Yeah.
So, the saliva component, what makes up your saliva, which is often genetic, that is what it is. What are you going to do, right? And the same thing is true for as we get older for periodontal disease. There's a genetic component to that too. Some people are more prone to recession. Some people are more prone to open bites. Some more people are more prone to having a big jaw, small jaw. Genetics is such an important thing. But for those kids that unfortunately are more prone to it, they just have to be a little bit more careful about everything, right? What they eat,
Right.
about brushing. But every kid is different. And we have to treat, as you guys do, right? You have to treat every patient differently. Right? We can't go cookbook for everyone. So even though my kids are siblings and have similar genetics, but actually different genetics, we treat them differently because they have different problems.
Oh, I like that.
I think that that makes a good point that, you had kind of alluded to this when you talked about how parents talk to their children with this threatening, like, oh, if you don't brush your teeth, you're going to have to go get a shot, you're going to get another cavity. And I think we need to be super careful that we're not being overly punitive, right? Like you made that comment that it's not necessarily fair how you
Mhm.
get cavities. And so I feel like, even as a parent, I have to be careful in not placing too much blame on the child that's prone while still really putting fear in them that you need to be brushing your teeth really well and flossing, right? Like I need to walk that line while also not trying to draw a comparison of, oh, if you were just more like your sibling, this wouldn't have happened. I never want to
Right.
do that
Oh, I
because there
can't say
really
that
is a
one.
clear, yeah, there's really a clear like unfairness to it.
Yeah.
I think that's a good way to put it.
So far, we've talked about cavities, how they're formed, and how we can prevent them in our children. In the second half, I want to hear, Bobby, in your house, how you guys do Halloween and trick or
Ooh,
treating
yeah.
and
What
candy.
do you do?
Tell us secrets, dentists revealed.
We love Halloween.
Okay, you trick or treat
So we definitely trick or treat.
for candy, to be specific, right?
So
What do you guys
yes.
give out? That's what I want
Right.
to know.
Give
So
us
my
the
I'm
candy.
either
details.
like,
This is gonna be.
toy
I
household
can't
or
believe I'm giving this
pretzel.
away in a
Yeah.
technically public forum.
Yes.
Okay.
Okay. Tell
So
us.
so first of all, I give out treats and toothbrushes at my house when I'm
Okay.
giving them out. So
Nice.
that's first.
Flossers.
Yeah, whatever it is, flossers,
Eat
toothpaste,
eat
toothbrush,
this treat and
depending
then
on what we
brush
have
your teeth.
inventory in
There
the
you go.
office,
Very
but
nice.
definitely dental related things.
Okay.
Plus a snack.
Okay.
But I let the kids go crazy. They can go trick or treating and
Okay.
get as much stuff as they want,
Okay.
and then they go to sleep.
They don't
And
eat candy the night of
no,
Halloween?
of course they do. Listen, I'm
Like
a realist.
how many pieces? Like what are we talking about here?
So fortunately, I mean, they're like sneaking stuff in as much as they can. I let them go to town on that night because
Okay.
otherwise, I'm a realist.
Okay.
But then they go to sleep, and those big pots of candy. Then I take it to the kitchen table and pour it out, and then I start kind of separating out certain candies.
Do you?
And they kind of know, but don't realize how much I do.
Like
Uh,
how do you separate? Like these candies cost the most
yeah.
cavities. These are the least cavity forming. Is that kind of you have a scale?
I mean, more or less, yeah.
Mhm.
Ooh, let me mention this about cavities. What's worse? What do you guys think?
Okay.
What's worse, having 20 M&Ms or pieces of chocolate
Okay.
all at once, or having 5 pieces over the course of an hour?
I would say what's worse? I
I
would
would
say
say,
5 pieces over an hour.
yeah, this is what I would say too.
Yeah.
That's correct. That's correct. Right.
So
So it's
you're
not
all for the
necessarily
Too fast.
binging, right? Like all
in town, have them for 3 hours. So all right. So I lay out the candies, and the
Okay.
reason I brought that up, because certain candies, think about like something chewy, like a Starburst or a caramel or Laffy Taffy. Oh, Laffy Taffy, the worst. Okay.
There we go. Laffy Taffy.
Right. So
Airheads.
it's
Oh, my
like,
kids love
They
Airheads.
love
oh,
that
Airheads. Yeah.
stuff.
I mean,
Yeah.
listen,
Yeah.
I like Airheads. They're good, right? I get it.
Really?
I get it. But like they're terrible for your teeth, right?
Okay.
Yeah, you roll them up, it's fun. So those things that are going to be in my head the worst for you,
Mhm.
the things that are going to be in your mouth, cavity formation, the 20 M&Ms versus 5, it's
Right.
about duration, right? Not about quantity of sugar because you're
Okay.
swallowing it.
Right.
So I don't want those candies that are gonna like linger and linger and linger and linger, right? If
Mhm.
you have a Snickers or one of those mini Snickers or any of those little chocolate ones, okay, they chew it and they swallow it, right? It's not sitting there, depending how much caramel is in there,
Right.
right? But so it's all
Yeah.
about like those things that are gonna sit in the mouth for a while, or the
Mm.
really, really hard ones. I don't like those either.
Like they crunch on the sugary candy?
Yeah, or like not like jawbreakers. Oh, those are obviously bad, but like the mini versions of those, the ones
Sure.
that are, yeah. And plus things that like I might want to
So what
steal
do
a little
you
bit.
do with the worst candies then?
Oh, I get rid of them.
What do you mean get rid of them?
I mean, I
Oh, I,
quickly get rid
You
of
like
them.
throw them away?
Can we pretend that I donate them?
Okay. You
I
donate.
what
We donate ours to the dentist. When we donate our
Oh, a
bags
candy
of
buyback?
candy to the dentist,
Yes,
do
yes.
they just throw it away?
No, no, no. There's a military group or like
Mhm.
a fundraising military group that would more or less send the candy to wherever they are,
Mm, mm, mm,
not in the
mm.
US.
Yeah, yeah, yeah.
I feel like what you've said kind of goes along with something we say in pediatrics about sugar. It's like okay in like controlled limited quantities, and you kind of make the case for this idea of like, okay, you eat dinner, now you get to pick your piece of candy or your dessert or whatever, and I know that you're going to brush your teeth right after. It's a little bit different than like the candy's available, just come and grab it throughout the day when it's just sitting there on your teeth all day long. If we can do it in that sort of systematic way of, okay, now you get your treat after dinner and now we're going to go brush your teeth, that might be a reasonable
So you
option.
you just nailed it. So we have a candy bin, and it's those leftover Halloween candies, and they are allowed to have one after dinner if they eat, the good food. Then they're allowed to have a dessert, and it's one candy, one appropriate candy. Yeah,
One
we
pre-screened candy.
it's a pre-screened candy. So like we love Halloween. We get dressed up, family costumes. We go all out. We've done some like big things. So getting candy and trick or treating is part of Halloween. I can't take that away from them.
Okay.
Yeah.
But I can definitely at least help with the choice of candies.
Let's turn our attention now to something that has been very much in the news, and that is fluoride. Talk to us about fluoride and your thoughts on fluoride.
Fluoride strengthens your teeth, and fluoride in small doses, I should say. Fluoride's just a little mineral, right? That wants to help people's teeth get stronger. Like we've had fluoride in the water for so many years. It's not like it's something just happened. And we've had years and years and years of data to show that at appropriate levels, it's safe. Every dentist will agree. If you have too much fluoride, yeah, it's not good for you, right? But also, if you have no fluoride, guess what? It's not good for you either. It helps strengthen your teeth. Our kids usually get fluoride in two forms, either from ingestion, whether that's in the tap water or in the foods that they're eating, or even in some formula, for example, or they get it topically by brushing their teeth, right, with fluoride toothpaste. And the recommendation from the American Pediatric Dentistry Academy is that as soon as there's a tooth in the mouth, that tooth should have fluoride touching it when they brush their teeth, right?
Right. Well, Bobby, thank you so much for coming on to our show. I've learned so much about pediatric dentistry today.
Yeah, I think you're going to help me not just as a pediatrician, but also a parent. I will say I really enjoyed reading your book. There were things that came up that I've experienced with my children that I thought, oh, I didn't realize that was that common, right? That clearly were common enough to come into your book. So I do recommend that to any parents that are interested as well.
Well, thank you guys for having me. It's been a pleasure.
Great. This is 10 Kids, 2 Docs. I'm Dr. Sylvia Bank.
And I'm Dr. Vivian Carlin. We were here with Dr. Bobby Geiman, and we will see you next time.
See you next time.
Thank you for listening to 10 Kids, 2 Docs, hosted and created by Sylvia Bank and Vivian Carlin. If you enjoyed this episode, please subscribe and recommend our podcast to other listeners. Visit our website at 10kids2docs.com, where you can find links to social media and leave comments or suggestions. Back next week with more topics in parenting.